The Limpopo and Mpumalanga provinces are facing an outbreak of measles. Figures from the National Institute for Communicable Diseases show that the provinces have recorded 99 cases of measles between September and November. Limpopo has the highest number of cases at 77. Well, let's discuss this and what is being done to put the situation under control or contain the spread of measles. I'm joined now by the MEC of Health for Limpopo, Dr. Phophi Ramathuba. Good afternoon, MEC. Welcome to today, and thank you very much for your time. The numbers, 77, I understand is even higher than the same period in 2021. Are you concerned now about these new cases of measles in your province?
Yes, indeed. Good afternoon, and afternoon to all your viewers out there. As a province, indeed, we are very much concerned because since we have declared an outbreak which started at Sekhukhune district around September, we have now up to date, the number have increased to 85 confirmed cases, of which we had 633 that were suspects, which we have been able to do the test, and we confirmed the 85 of those. And I must indicate that all the 85 are out of isolation. We don't have any active cases this week. We have not registered any new cases this week. We have not registered any single death since the outbreak. But however, it is a concern, especially that measles in its own nature is one of the highly contagious infectious disease globally. What we must also indicate to the public is that it has always been a norm that every 2 years we go for a measles vaccine campaign because as a country we've declared to say by the year 2030 we should have eradicated measles. Now the impact of COVID-19 on the healthcare services included the measles because 2020 and 2021 we could not do any campaign. And that also had an impact because even parents at the beginning of COVID were reluctant to go to our clinics for routine vaccination and immunization of their children. That is why you see us having this particular outbreak.
Yeah, so when are you going to do the next drive? Because as you say, you could not do it due to the lockdown, due to the COVID-19 pandemic in the last 2 years.
We already started the campaign because what made us to be able to pick up, it's through our surveillance because in the beginning of the year, when COVID-19 had given us a breather, we, as part of our program of catch-up in a number of disease, for instance, your patients who have defaulted on HIV, TB, and all that, including the vaccination for the children, we had to put up a surveillance, and the surveillance team has been able to pick up. We did, in the beginning, I think around June, July, we took specimen for more than 2,000 patients where we did our testing. So that is why in September we've been able to start picking these cases up. So what we can also indicate is that we started because the first district to be declared was Sekhukhune. Immediately in September, a vaccination campaign or drive started that time where we targeted children between the age of 6 months up to 59 months so that even others, they were getting their boosters. We have then moved to Mupani district and now we have rolled it out in the entire province because it is only Vembe district which has still had recorded 2 or 3 cases which has not yet been defined as an outbreak, but all the other 4 districts have got an outbreak. So our campaign will continue up until January. What we are also targeting is to say, as I've indicated, it's highly contagious. We will know that most of the children who are staying, some children are staying with their parents in Gauteng for economic activities. They will be coming back home. So we will also be campaigning and even on the road to advise parents to say, even if you reside in Gauteng, make sure that your child has been fully immunized. If their child has been fully immunized, you are welcome to get them a booster because The concern is that children will be coming to the province, children will be moving across the SADC. We know what is happening in our neighboring countries. They've already registered more than 700 deaths somewhere in September. I'm not sure what is the latest now.
Which countries? Which countries? Is it various countries around us?
For instance, if I'm to give example, in our neighboring country, Zimbabwe, they had already registered more than 700 deaths as early as somewhere around September. So
now, MEC,
it is a concern.
Yeah,
yes.
I was going to ask, we don't have a lot of time left, but I needed to understand measles, of course, you correct, as you said, it's a highly contagious viral infection, and it can be passed on easily. So you're going to be focusing on protecting the children, those who are traveling into Limpopo, and so on. Can adults get measles? I'm asking Dr. Phophi Ramathuba now, not the MEC.
In terms of our cases, we have recorded from the age of 7 months up to 42 years. So we have a 42-year-old who has been diagnosed with measles. One of the common denominator in most of these patients are that, especially with children, those who are infected, it's only 9 that we could prove or had evidence that they were once vaccinated. Majority of them have not been vaccinated. With the adults, we do understand that if you were vaccinated as a child, chances are your the vaccination might have weighed off, because for us to get immune system protected, you either get infected by the measles, therefore your body will develop natural immunity, or we vaccinate you. So the major challenge here is that children have not been vaccinated, and that is why we're seeing this particular outbreak.
And
so to answer you, yes, in adults
can't get it. Okay. My final question to you is, what coverage are you targeting in Limpopo? Because I understand that you need about 92 to 95% coverage in order to provide wider community or prevent wider community transmissions.
The advantage with measles is that it's not a novel virus like we do with COVID. Is that children, when they are born at age of 6 months, they get the first dose. At 12 months, they also get a second dose. So what we are currently doing is to target, especially where we have seen outbreak in those villages or crèches, daycare centers, schools. We're saying children must get the booster. We are now boosting all those children. And those that have not been vaccinated, we are starting with the vaccinating them. So we are currently doing well, especially in the Sekhukhune district where we started. We are just now we need to focus on districts like Vembe, where we because they have not been declared an outbreak, we think they've been relaxing. So that's what I can indicate to you to say. It's a measles, unfortunately for us, it's not something new that we're dealing with. So it's just giving children a booster in most instances, and those that were not vaccinated, starting from scratch.
So it could be a province-wide campaign that you are doing now until January.
Yes, we are. It's a provincial campaign where we're targeting those who are coming, because if we don't do that, they're going to get infected, and when they come back in January for the schools, they're going to be infecting, and you will find, as I've said, it's highly contagious, that the entire country now, it's in a crisis. So that is why, as a province, we want to make sure that when your children come back home or they're coming here for holidays, they are protected and they are safe. So don't be surprised as parents when you see us on N1 asking you if your child has been vaccinated, or can you offer, and please cooperate with us. We're doing it to protect not only your child, but the entire nation.